believe so. So let's move on to item number 4, which is the COVID-19 staff update. Okay, Marilyn, are you kicking us off?
Yeah, I'll go ahead and kick us off. Marilyn Manigan, Health and Human Services. Well, we continue to have low numbers. We did add a case yesterday from over the weekend, bringing us to 1421. Last week, we reported to your board that we were had submitted to the state our intent to adjudicate their tier metrics for Inyo County, because last week when they posted that we were in red, which we knew we would be in red, but they posted that our metrics met red criteria for case rate, and we wanted to adjudicate that. Even though that was our first week, it was important for us to adjudicate the metric determination for case rate in order to ensure that the next 2 weeks take into consideration the uncounted vaccines that Toyabe has administered. So even though that won't have an impact on us moving this week into the next tier, it does ensure that when they are doing the tier assignment today and looking at what our metrics are, that they are taking into consideration the underreported Toyabe vaccinations. So, and again, that's not an underreporting on Toyabe's part. It's because Toyabe gets direct allocations from the federal government. It does not get captured in the state system. So we fully anticipate being able to meet the orange metrics in both positivity and case rate for this, our second week in the red tier, which will be posted today. And as long as, next Tuesday, when they post next Tuesday's data, we remain in the orange tier as far as our metrics go, then we will officially be able to move into the orange tier the following day. We don't anticipate at this time a glitch to that, but we always want to make sure that we are hedging our bets and making sure that we are not overcommitting to your board and to our community. Over the weekend, we had a great clinic at the fairgrounds. We were able to vaccinate, I believe, close to 500 people with first dose, and some of them are 16 and 17-year-olds. And Anna's going to give you an update on that, as well as some of the upcoming clinics. And I'm hoping that Dr. Richardson will be able to give us an update on the Janssen vaccine, or the Johnson & Johnson vaccine. So Anna, if you wouldn't mind.
Thank you. Yes, we did have a successful clinic in Bishop using Pfizer vaccine over this past weekend. I want to thank all of the volunteers who came down to help us. We had a lot of community members there. We did partner again with Northern Inyo Hospital, so a lot of our vaccine providers were from Northern Inyo Hospital, as well as some of our county employees. We also had volunteers, medical volunteers from other agencies like Toyabe, Vaughn's, and other locations. We had pharmacists from Dwayne's helping us out again. So we have really just so thankful for the amount of volunteerism, the individuals who've been able to help support those larger events. So I want to thank everyone involved. We had a good event. We had the capacity to do upwards of 1,500 appointments. I looked at the numbers again today, just making sure everything has uploaded into the system. We actually were at 496 vaccines administered. So yesterday I was passing out a number of 493, but looking at everything reconciled today, we added a few more cases or a few more vaccinations in there. So 496 was our total for the weekend. Still a really good turnout. Happy to have those people covered with the Pfizer vaccine. This did give the opportunity for some of our 16 and 17-year-olds to get in and have the opportunity to be vaccinated, because that's not right now something that we have generally available through our Moderna clinics, which are 18 and over. So that was a positive event over the weekend. We are going to be in Lone Pine on Thursday. And so a couple of points I want to make sure that I'm sharing with your board and the public who are listening. We will be providing Pfizer vaccine on Thursday. The clinic will be at Statham Hall starting at 2:30 p.m. So we're scheduled to start right after school gets out. Again, getting some information out through the school to make sure our 16 and 17-year-olds in the area are aware and their parents are aware and can take the opportunity if they're available to come down. We'll be starting at 12:30 and going to 3 o'clock. Now we are advertising that we will accept walk-ins. However, the challenge again with Pfizer is that we have to keep it frozen until we're ready to use it. And so because it has to be transported down, we're going to have some limited availability to accept walk-ins. So we will accept walk-ins, but we're only going to be able to do about 12, given that we won't be able to thaw more vaccine or get more vaccine there because we can't store it on site. So we will be also hosting an assisted registration this evening. We have, in partnership with our, we have staff from our prevention division, part of public health and prevention, will be down in Lone Pine this evening. We will be set up at our wellness center, which is at 310 Jackson Street in Lone Pine, from 5 to 7 p.m. So we will be helping anyone who's having trouble signing up for the vaccine clinic through myturn.ca.gov can go down to our wellness center. Again, that's at 310 Jackson Street. We will have staff available and we'll be able to assist in both English and Spanish for helping people get registered in advance. We do want to encourage people to register if they possibly can through the MyTurn system or by going to that pre-registration event. Get as many people signed up in advance as possible so we know we have enough vaccine transported down. Again, we'll have some capacity to accept walk-ins, so we will plan for that, but that capacity will be somewhat limited due to how we have to manage our vaccine. Do want to just hit on the fact that we continue to have a good supply of Moderna vaccine coming in, continuing to provide Moderna vaccine through Southern Inyo Hospital. Their rural health clinic is providing still appointments Monday through Thursday, and those appointments can be made by calling the rural health clinic at 876-1146. In the Bishop area, continue to have Moderna vaccine available through Vaughn's Pharmacy. They're providing Monday through Friday and have a variety of appointment times available. So Vaughn's Pharmacy is available by going to the myturn.ca vax. There's a link for the pharmacies at the bottom of that page, and so you can register for vaccine at Vaughn's Pharmacy in the Bishop area. Valley Health Team continues to provide vaccine on Mondays and Mondays through Friday. They have appointments available, so they're still providing Moderna vaccine. And then Northern Inyo Hospital is also still doing their clinics on Tuesdays and Thursdays. Dr. Richardson will talk a little bit about our the update for Janssen vaccine. Recall that we did pause administration of Janssen for a time while we took a look at some of the safety data that was coming in federally, and also after review by the I have to remember what this is a long name, but the Western States Scientific Safety Review Work Group, which is a collaboration amongst Western states to also take a look at vaccine safety, both at the FDA and CDC level. Janssen has been continued, we've been given the green light to continue to administer Janssen vaccine, and then also the Western states have supported that decision, and in California we are moving forward with making that available. So we do have some Janssen vaccine availability. Also, Rite Aid in particular in the Bishop area has been receiving Janssen vaccine and will be resuming appointments. We have a couple of other pharmacies looking at potentially offering that up, and through public health, we do have a small supply where we're looking at getting that out through some targeted clinics. We're working with IMACA right now and Inyo County Behavioral Health, as well as looking at whether we have additional inmates at the jail who have not already had the opportunity, that we have had the opportunity to do that through provide vaccine to inmates through Southern Inyo's clinic. So continuing to look at ways to get that vaccine out and available and increase the opportunities for that. Finally, I do want to mention that there has been a request that is pending review under the emergency use authorization for Pfizer vaccine to potentially expand availability of Pfizer vaccine for individuals aged 12 through 15. So getting more of that group of teenagers covered. So we don't know when exactly or if that will be approved, but we are starting to plan. I know at the state level, we're starting to look at how to plan for that potential expansion over the next couple of weeks and be ready for that when and if that approval comes in. So we're looking certainly also at the county level. All of the counties are looking at what that may mean as far as having availability of the vaccine, what other providers can be brought on board to be able to help distribute. So we'll still be managing the logistical challenges that go along with the Pfizer vaccine, just the storage and handling challenges that we have around the use of that vaccine, but still encouraged to know that we may have even further expansion and eligibility coming up. So we'll continue to monitor that and plan for that. And I will pause and see what Dr. Richardson has to add around vaccine.
Good morning, board. Yes, Anna stated that the Johnson & Johnson vaccine the pause has been lifted as of Friday. And the CDC and the Committee on Vaccinations stated that the benefit outweighed the risk for this very rare syndrome. Apparently there's now 15 cases out of 8 million doses, so that's approximately 2 per million. And they were all cases, 15 cases were women aged 18 to 59. So the conclusion was the holding up the vaccine any longer would result in a increase in severe illnesses and deaths, because many people want the single shot vaccine, and the side effects of this clotting disorder is extremely rare. So they opened up the vaccine for anyone as long as they have a informed decision-making decision on the side effects of the vaccine. I'm not sure what the specific requirements that will be included in that informed decision-making. I'm sure it'll revolve around women 18 to 59. All the cases were in that group. If you've noticed the news lately, there is apparently one male in the San Francisco area that is also being added to the list. I don't know if that's confirmed yet, but he was admitted to UC San Francisco Hospital and with a clotting disorder. He's doing well, but that is the only male out of the 15 cases of women. So it remains to be seen if this is a true case or actual clotting disorder of the usual type. The symptom onset for the clotting is usually 6 to 15 days following the vaccination. So imagine guidelines will be revolving around watching for any side effects and preparing for anything that occurs with use of different kinds of treatment unrelated to our usual treatment for clotting disorders. So it's important that they made the pause so all the public and the physicians can be aware of the diagnosis and screen for it and treat it accordingly with the unique treatment that they have. The other issue that's coming up, and you may hear a lot about it, is masking. There is, the CDC recently released a new guideline on masking. If you're fully vaccinated, you can take off your mask in indoor activities with other vaccinated individuals if you're in small groups. Outside activities, they're still recommending masks. There's some details that went with that, but you're going to notice masking requirements are going to change. And I think that's important. If you recall, 2 months ago, I recommended we shouldn't let our guard down with our mitigation guidelines and public health guidelines for prevention. But I think it's getting close to a transition when over the half of the US population has had at least one dose, and we're vaccinating just about everybody we can find in Inyo County. So I think that the transition of that strict guidelines that the CDC and the CDPH put out are going to have to be looked at with some discretion and common sense. But moving forward, we'll see how that plays out. I think instead of mitigation, we should be thinking about participating in normal activities again, and how do we do that and still be safe? So that's going to be what we can look to for the future.
Okay, thank you, Dr. Richardson. I guess, do we have any comments or questions from the board?
I've got a couple, sure. So one of my questions is how soon will we start to administer the J&J vaccine? Is it immediate, or is there still some steps that we're going through?
I believe that there's going to be some steps. That'll probably come down from CDC to the CDPH on probably the informed consent and decision-making process. This decision was just made last Friday.
Yeah, no.
So
Okay.
we'll have to see how it evolves. It should evolve rather quickly because the board, the ACIP board that met, felt that the vaccine needs to get back in use because of if the longer we withhold it, the more likely we're going to see severe disease, hospitalization, and deaths when a lot of people could benefit from it. So I think in the next couple of days, we should see some guidelines on how to initiate or reinitiate the use of it.
Thanks. And I want to thank staff, Anna and Marilyn, and all your staff for working on the clinic here in Lone Pine, and the idea of coming down and doing registrations. That does seem like a great idea. Do you know how registration is going so far?
Yes. fact, I just wrote it down and I want to make sure I see my note. I think we have, as of right now, 43 registered.
Okay.
So we have the capacity to do about 180. So we definitely still have some room, especially I think, and this is what we saw too in our Bishop event this past weekend, is a lot of people sign up for the first couple of slots and so we are busy to start, and then it kind of slows down towards the end. So there's still a lot of room through the early afternoons, lots of slots available for people to register.
Okay. I know the Rural Health Clinic down here is doing, seems to have enough vaccine, so they're really making themselves available. In fact, I think Peter mentioned that they were almost doing walk-in vaccine. You know, you could just come and they could administer it. They had that capability. So it's great to have all of these different ways to reach out to people. And I'll do some work too here in the next couple of days to make sure that people know about it. And especially we are aiming for those younger residents.
Thank you.
I could ask a question, Mr. Chair.
Oh, sorry.
Sure, go ahead.
Yeah, hey, just so if you participated in the clinic this last weekend, do you need to get back on my turn and set your appointment for the next time, or do you basically go back the same time 3 weeks later?
When you register for your first appointment, automatically in that system, your second appointment is set. So everyone who registered already has their appointment. So they'll be coming back either on the 15th or 16th. We have talked to a couple of people that needed to shift around and come a day earlier or a day later. So that takes a little bit of work within the system, but we certainly have the capability of accommodating that. So everyone who's received their first dose already has their second dose appointment.
Okay, thank you.
A couple questions. Go ahead, Rick.
Well, I just had a question come to me about if you've had COVID, is there a waiting period before you get vaccinated?
No, there is not. For example, let's say you've had well, in general, let's talk about that case, COVID. If you had, and we've had several cases like that. If they have COVID, they stated by the CDC that you're probably immune and protected for reinfection for at least 90 days. But that statement has been due to the fact there was one point when we were short of vaccine. Now that we're not short of vaccine, people can get vaccinated before that 90-day period of, that was a projected time of immunity. That's changing all the time, but the vaccine can still be given even after you've recovered from a case of the COVID-19. After you've totally recovered, you can get the vaccine.
Thank you.
Couple questions. Thank you, Rick. That was a good question. So my question kind of spins off of that with regards to the travel guidelines for visitors coming in to California from out of state. It still indicates that you have to have a note from your doctor stating you've had COVID, or of course the vaccination, or that you have a negative test within 72 hours. So it seems to be indicating that if you've had it, you can't get the vaccine because you had it. And so I'm just kind of wondering if anybody is realizing or hearing that the state may modify the travel restrictions. Does that make sense?
I haven't seen that guideline where if you've had the disease, you can't get the vaccination.
I could be saying it wrong, but when you look at the travel guidelines, it seems to indicate that that's one of the factors. And maybe Anna, if you can correct me if I'm wrong, but it seems to seems to be, well, it's confusing, to be honest. It seems to indicate that if you've had the disease, then you have to have a note from your doctor to travel.
So to clarify that, early on, and I just want to make sure I say this again, because I think Dr. Richardson explained this too. Early on, a couple of months ago, as we were starting to roll out vaccine, we were discouraging people who'd been recently within the last 90 days positive for COVID from getting the vaccine while it was still very limited in availability. At this point, and I can't speak for every other state, but I know in California, there shouldn't be any problem with anyone who's previously been positive and getting access to vaccine at this point. So the state guidance right now for travelers from out of state is that they should be vaccinated or tested before traveling. And so to the extent, if they have access to testing, even if they've been positive in the past, primarily they have access to vaccine. I think I just said testing. They should be able to get vaccinated at this point and be fully vaccinated before traveling. I'm not sure if there are little pockets where vaccine is still very limited in certain areas. It just really depends on where someone's at. But at this point, they should be able to seek out vaccine and receive vaccine. If for some reason if they're not able to access that vaccine or get fully vaccinated before traveling, we do want to fall back on that testing within 72 hours of travel. And there may be a small number of people who've previously been positive in the past 90 days who can demonstrate that they've been positive and have some inferred immunity, but haven't been able to get access to vaccine. I would say that should be a very small number of people at this point that don't have the access.
Okay, thank you. And then the other.
To keep it simple, those are three options I guess you can take. If you've had the disease and you haven't had the vaccine for whatever reason, you get a note from your doctor. If you've been vaccinated and you have proof of that, that's fine. Or you get tested. I don't think it implies that you can't get the vaccine if you've had the disease. Those are just three ways you can sort of get a passport to whatever.
Okay, thank you. My other question, Dr. Richardson, you'd mentioned, and I think I missed what you said just prior to that about updating the guidance that as we progress with the vaccinations, that outdoor activities will still be required to be masked up?
No, they won't be. When you're in outdoor activities and you're vaccinated, you don't have to wear a mask. I think these guidelines are going to be changing. And I think today you'll see some of that. I'm sure it's going to come out from the CDC. So if you're fully vaccinated, you don't need to wear a mask outside. And that brings up, events like Mule Days are coming up, and you think about what's going on with, if people come in and they show that they've had the disease and they've been vaccinated, and we have vaccinated individuals here, this is where I was talking about the common sense issue. It just makes sense that if you've been vaccinated and you're outside, and you can even be around unvaccinated people, because the risk of transmission is outside is 19 times lower than indoors. So I think it makes sense that you don't have to wear a mask. Now, obviously that's a wise thing to do, but it's not, I think it's becoming less and less a requirement.
So I'll just add that, yeah, going forward, we expect those guidelines to shift over time. We did see the change in the CDC guidance for very small private get-togethers around people who are fully vaccinated and not having to wear face coverings. We're still seeing, though, for under both CDC, CDPH, OSHA is all requiring, this is a question that we have a lot right now. The guidance still is that in workplaces and other public places that the face coverings, particularly indoors, are still required. And we're just expecting that over time, as we see more people vaccinated, we're going to see changes to that guidance and likely though I don't know that I've heard any timeframes specifically, but I know that at both at the federal level and the state level, certainly at the local level too, we're all considering how do we balance that lower risk as we go forward.
That's well put. And I appreciate also what Dr. Richardson said, where discretion might be as much the indicator here. But I do see that as we're moving in the trends, and Marilyn mentioned, perhaps we would be moving to the next level as early as May 5th, correct? So I'm just kind of wondering if our trends continue, if the adjudication is successful and the trends continue, if that would put us in the, orange tier by the 5th, and then perhaps even 3 weeks later, the next tier.
Yes.
Yes, and just to clarify, and I failed to alert your board that the adjudication did occur and the state concurred and did designate our metric for case rate based at on our first week in the red tier as meeting orange criteria. So that being said, we fully expect that as they look at applying the small county metric, where they will look at potentially absolute case numbers and vaccination rates, that will be taken into consideration, that we have an unaccounted for population who have been vaccinated. So, so yes, if we in fact go into orange on May 5th, then we would have 3 weeks in that tier before going to yellow, and which is good, even though it's very close to June 15th and the moving beyond the blueprint. The more we can move towards a less restrictive but safe environment for our business and community and our population, the better.
Thank you. And my last question is just and thank you for the assisted registration. What time was that? 5 o'clock, you said? At the Wellness Center in Lone Pine?
Yes, 5 p.m. to 7 p.m. at the Wellness Center in Lone Pine today.
Thank you. And then just the last bit with regards to my turn, if you're in Independence or if you're in Keeler or Darwin, you would still use the 93545.
Yes, yes. If you can either use the Lone Pine zip code or type in, and really the geofencing that's been done has been expanded a little bit. I noticed last week we were starting to pick up some of the Fresno clinics, but that also helps. I would say if someone does enter Keeler, they will still see Lone Pine pop up as the closest. So yes.
Thank you. That's all I have.
Yeah, I think that geofencing is, I occasionally just log on to see how many slots are available, and it's now popped. So if you're put in Bishop, it shows Lone Pine, Mammoth, and Fresno. So I think that problem is not a problem anymore.
Yeah, it's definitely expanded.
We have a hand raised from Tamara Cohn. Could we please promote her?
Good morning. I have a simple vaccine availability question. Can you confirm if Duane's is providing vaccine? And if so, how would someone get it through Duane's pharmacy?
Thank you, Tamara. At this point, Duane's is not part of the distribution network, though they are looking at the possibility of providing vaccine. I apologize if I'm speaking with outdated information, but to my knowledge, we're not yet having appointments available at Duane's, but there is some movement in that direction.
Over the weekend at the vaccination clinic, one of the pharmacists stated from Duane's, they do have Moderna, and apparently they still have some J&J. So how do you get in touch with them? I would just call the Duane's pharmacy. Maybe you could make an appointment through them. I don't know where they acquired the Moderna. They didn't get it from us, I know. Correct, Anna?
Yeah, so the bottom line, Tamara, I apologize for this, but we know that they're moving in that direction and don't have the specifics about how and when the vaccine appointments will be available. But we will get that information out through our vaccine updates on a weekly basis as soon as they're ready to start providing the vaccine.
Okay, thank you.
Thank you for the question, Tamara. And do we have updated numbers on fully vaccinated people and how many shots we've gotten out in the county?
Yes, I can speak to that. And as I have been doing, but based off of what the statewide numbers are looking like, we have, I'm sorry, I do only have with our Toyabe numbers. So right now, with Toyabe's numbers included 54% coverage rate. That means 54% of individuals who live in Inyo County have received at least one dose. And then 40% fully vaccinated. So that's based off of the statewide data based on Inyo County residents and includes the most up-to-date information we have about Toyabe's coverage as well. So that is statewide, I believe we're at 37% fully vaccinated.
Thank you.
I have one more question before we move on. As our vaccine seems to be outpacing our demand, are we still right now only giving a vaccine out to Inyo County residents, and then at some point will that change and we'll just say anybody who comes in, or how is that working here or statewide?
Yes, certainly at the statewide level, where we've been trying to get to no wrong door, meaning wherever you can get an appointment and want to go, you can go. At Inyo County at this point, we're, especially with eligibility expanded, and we're really just making sure that individuals meet the age criteria for the particular vaccine they're receiving. We did not require proof of residency for our vaccine clinics this last weekend. I do not believe any other providers are checking residency at this point. We certainly want to make it available. We have appointments available. We have the vaccine in hand. We want to make sure that anyone who wants it has the access. So no specific requirement to establish that they're residents of Inyo County at this point.
Thanks. I mean, I think that's wonderful that we've gotten to that point. That's amazing in some ways.
Okay, thanks. I have my meeting with Dr. Gali tomorrow, maybe the last one I had with him. So maybe one more after that, but there seems like a less and less need for that. So if there's any specific issues, please let me know. Leslie, did you have anything to add?
I do, just very quickly. The Restaurant Revitalization Fund registrations opened up this morning. So restaurants can register there, and then the application period starts on Monday at 9 o'clock Pacific time. And so I think that I know for sure Oak Valley Bank, Eastern Sierra Community Bank is doing the loans, and I also received some really good instructions from our friends up at Mono County. I went ahead and forwarded those instructions to all the restaurants that I have email addresses for. I'm not sure that I have every restaurant on my list. So if you hear of someone, or one of your constituents could benefit from that information, please reach out to me and I'll make sure they get the instructions. And that's all that I have to report today. Thank you.
Thank you, Leslie. I guess I will also report that Amaka and Mammoth Lakes Housing is doing outreach and assistance for their rental relief program through the state of California. Apparently it's been pretty well received, but there's still some funding left in that program. So basically how it works is if landlords agree to participate and take 80% and forgive the other 20%, then the state will pay a full 80%. If the landlords don't participate, then the tenant can apply and get 25% of the back rent. And there's also 100% coverage of past due utilities through that. And then
Jeff?
Yes?
Or Leslie, who initiates that process? The landlord or the renter?
It can be initiated through either one.
Okay, thanks.
It's best if both agree.
Well, yeah, I get that. Yeah, but
Yeah. And then also City of Bishop decided last night that they would apply for a couple of CARES CDBG grants. One to assist Wild Iris with some of their housing needs. And the other, they agreed to apply for $200,000 for more small business relief funds within the city. Does anybody else have any questions for Leslie or anyone else? Okay, thanks everyone.